Press pause now while you read the answers. Press play when you're ready to see the correct answer. Right now, so this question is about elective surgery, that's one of the factors, a recent myocardial infarction 4 weeks ago. Number 3, the patient has a coronary stent, 2 types as you know, drug-eluting and bare metal. And the patient's on aspirin and clopidogrel. So those are the sort of 4 factors we have to think. The correct answer is answer 5. And that's because the patient who has had a drug-eluting stent put in and has had a recent heart attack should not have elective surgery, i.e. surgery that can be postponed safely so soon. So if you were to do surgery on aspirin and clopidogrel, both blood thinners acting on platelets, then you may have bleeding into the joints, you may get joint infection, and that's a disaster. The second thing you might say, well, why don't we stop the aspirin and clopidogrel? Well, we know that the risk of stent thrombosis is dangerous, is high, if you stop aspirin and clopidogrel early. So what we do for a bare metal stent, you should be on aspirin and clopidogrel probably for maybe 2 months after the stent insertion. And if you have a drug-eluting stent, you should be on aspirin and clopidogrel for a year at least. So we would try and postpone any elective surgery, any planned surgery that can be postponed for at least those times. After those times, you can probably stop the clopidogrel, but this is a discussion for the cardiologist who are experts in this, not us. So we will probably stop the clopidogrel after 2 months and 1 year respectively and carrying on aspirin. Now some operations can't be done even on aspirin, and there we would try and stop the aspirin, maybe give some bridging anticoagulation, and then restart the aspirin as soon as possible to reduce the risk of stent thrombosis. Some people require emergency surgery, of course, and that's a different matter. If you come in with a bleed or something, you'll have to manage that as you do. And some people require, of course, cancer surgery, which is not an emergency, but can't be postponed, for a year, clearly. So there we would have to take a decision about the risk of waiting for surgery for the cancer and the risk of the cancer growing or spreading, and the risk of stopping the aspirin and clopidogrel and having stent thrombosis, and that's a difficult decision.